Hello, everyone. This is Annie Cartwright. I'm one of the attorneys in Husch Blackwell's education group. We'll be talking with you today about best practices and practical tips for planning to return to campus in light of COVID-19. Our goal here is to offer ideas for getting ahead of the curve in addressing education and operations issues that will definitely arise on your campuses, and to help flatten the curve on an institution-by-institution basis in terms of community health. Before we start, I'll go over some housekeeping items. At the bottom of your audience console are application icons. If you have any questions during the webcast, please submit them via the question box. We'll try to answer them during today's webcast. If you need a fuller answer and we're able to answer at this pressing time, we'll certainly attempt to do that afterwards. We truly appreciate your participation and encourage all of your questions. If you have any technical difficulty, please click the question mark help icon. It provides information about common technical issues. A copy of today's slide deck is available in the resource list folder icon. We have a lot of content on our slides today. It's designed as a tool to help you through these processes. We may not touch on every item, but you may wish to print that out. This program has been approved for continuing legal education credit in Illinois, Iowa, Nebraska, and Tennessee. Wisconsin and Missouri credit are pending. To report your hours in Illinois, Nebraska, or Tennessee, click on the CLE widget at the bottom of your screen and complete the questions. You may download a certificate of attendance from the certificate widget at the end of the program today. A recording of the webcast will be available tomorrow for watching and sharing. Once it is, a link to the recording will be emailed to you and will be available for about 2 weeks. Again, I'm Annie Cartwright. I focus my practice around helping colleges and universities navigate regulatory and day-to-day operational issues, most recently the swarm of issues around COVID-19 and those completely unrelated to COVID-19 that are nevertheless a priority for regulators recently. Joining me today are Pete Enko, Pete Land, and Sean Tassi. Mr. Enko is one of our key education contacts in our healthcare practice, particularly on COVID-19 issues. He frequently counsels clients on academic medical center and a host of other healthcare regulatory and compliance and transactional issues, including outsourcing student healthcare, clinical affiliation and education agreements, athletic department billing, and privacy and security. Mr. Land concentrates his practice on serving private and public sector higher education institutions and academic medical centers in a broad range of litigation and counseling matters. He serves as an advocate for educational institutions in court and administrative proceedings, as well as counseling on the range of student, employment, policy, and research issues faced by institutions of higher education. Sean Tassi provides real-time guidance to colleges and universities to help them navigate the complex regulatory landscape and make strategic decisions to achieve their institutional goals, particularly in the area of operational privacy and planning issues. He also provides day-to-day outside general counsel advice as well as litigation and dispute resolution services. We are not alone in this effort. We are backed by an amazing team of higher education lawyers, as well as an amazing team of staff that help us put on presentations like this. Today, we're going to help corral some of the hot button issues in this swiftly evolving and uncertain area of COVID-19 back to campus. We have a broad range of participants on today's webinar, everything from deans at small colleges who wear several hats to attorneys from R1 institutions with teams of attorneys who focus on very particular regulatory issues. We are going to try today to provide helpful practical guidelines for developing concrete back-to-campus plans, including general planning guidance, more in-the-weeds specific information for those with more experience in these areas. We encourage questions and ask you to let us know if there are areas where you would like us to do a deeper dive or back up a little and get more basic. We may do a podcast on that, write an article on it, or do a future webinar. Speaking of webinars, this is not our only COVID-19 related webinar or our only webinar related to some of the swiftly developing regulatory issues like Title IX that are very important to regulators right now. So please feel free to visit our Husch Blackwell coronavirus website. You will find links to many of these webinars. And if there are others of interest, please let us know and we'll make sure that you get a link to those. To set the stage very briefly, I will remind you all that we are not doing this alone as institutions of higher education. We are working with a number of agencies and shifting guidance that we need to pay attention to. Of course, this includes our health authorities and quickly changing state and local laws. For example, in Kansas City, we just got our first mask orders that our schools will need to comply with here in town. So stay abreast of those. And it's not just health authorities, it's all sorts of agencies that are issuing guidance and rules around COVID-19, everything from those focused on employment to business and the Paycheck Protection Program. Homeland Security is involved when it comes to things like cybersecurity around our Zoom conferences and video conferencing, and of course the U.S. Department of Education. Consider having someone on your campus do nothing but monitor this shifting guidance. We have different members of our team monitoring different agencies to make sure we stay on top of it, and we're trying to push out as much as we can. But every campus is different, so consider someone who knows your culture closely. Keep an eye on these and be tasked with responsibility for doing that. Speaking of responsibilities, some of our biggest responsibilities on campus are our faculty, staff, and students, and I'm going to hand it over to Pete Land to talk more about that.
Hi, thanks, Annie, and thanks everybody for joining us here today. I'm here in Chicago, and we're trying to get ready for a holiday weekend that will be different than they've all been up until now, but we appreciate you all spending your time with us on the eve of holiday break, hopefully. So my goal today is to talk about how to create a new normal for returning to campus for our key constituents on campus. That would be faculty, staff, and students. And like many of you, I'm sure, I've been checking in with as many administrators and in-house counsel as I can at different types of institutions to learn about the range of approaches people are taking to dealing with having people return to campus. And our group internally here at Husch have also been sharing dialogue regularly on this issue. As we do so, we try to remind ourselves to take a deep breath as often as possible. And I say that because if anyone out there has figured out how to do all of this, please let us know and we'll pass that along to others as well. Another thing I've been doing is I have two college-age sons, and I've sought their views as well as many of their friends as possible about what they're thinking about for return to campus, and I try to distill some of those perspectives down into the next few minutes as well. So unlike later portions of what Sean and Pete Enkel will be providing today, which are a bit more technically detailed, I'm going to try to address ideas for how to approach what amounts to really a need for cultural change on campus as people return. So three basic concepts to keep in mind as we consider how to manage our key constituents. One is balance that we'll need between the risk aversion, safety, and cultural adjustments. Another is we'll also need to acknowledge different constituents' perspectives if we want to succeed in adjusting people's behavior when they return to campus. We'll also want to work to carefully set expectations, each school should, for how you will enforce new rules on your campus. So those are three basic principles that should be considered as guiding some of our decision making to keep in mind today. Really what we're talking about is a balancing act, and let's consider what we're seeking to balance. We all want to avoid claims that we did not prevent foreseeable spread of COVID on our campus, or Rona, as my kids call it. For some reason, they just won't say COVID anymore, so sometimes I'll refer to it as Rona today to get us in the mode. At the same time, we seek to limit claims that we are not meeting our end of the financial bargain to students. We want to deliver the educational value that students and families expect. These first two risks are really at odds, largely at odds with each other, which makes it a challenge. All the while, we want to protect our people and help abide by safety measures designed to contain the spread of the virus by following public health guidance in both regionally and locally as well as nationally, and focus on reducing the density of interactions on our campus and changing how everyday interactions occur. That is quite a challenge to take on. I think what balancing these various goals and interests really means is that each institution needs to transform its culture. And that's not easy because our cultures have been cultivated over long periods of time, sold to attract students in the even ever more competitive higher education market, and we've lived with that for decades. Until now, if you think about it, all of our institutions really purposely found ways to mix everyone up together in a huge petri dish of interaction because doing so helped people learn and thrive on our campuses. Through various traditions unique to each of your campuses, we've all promoted the autonomy of thought and action, and we've created environments that allow people to express themselves and to determine individually much of how they teach, learn, and work. It's a unique and valued part of the fabric of most campus life. Now, as we return to campus in this age, while trying to uphold the principles we identified earlier, we're going to need to direct people how to interact in ways that are really foreign to most institutions. This will be challenging because first, people who will be subject to these changes have polarized views of COVID-related risks. And second, we have to expect circumstances relating to the spread of the virus and safety measures needed will ebb and flow. They're going to change, requiring multiple rounds of adjustments to the directions we try to give people about everyday life. Talk a little bit about the different constituents on the perspectives that may vary that add to the challenge of trying to create a new normal on our campuses. This is very generalized, but students, focusing mostly on the undergraduate community here, may be viewed as at low risk of adverse reaction to the virus. And many of them will view themselves as perhaps lacking any real risk of adverse consequences besides inconvenience. That's their view so much of the time. More and more, they know of friends who have had or have been exposed to Rona and haven't had any meaningful impact on them. That's part of their perspective about how the virus affects them. They've also been stuck at home or elsewhere, leaving them to crave freedoms they either know or want when living on their own at school. That kind of combination of experience will likely lead many of them to view safety protocols as a nuisance, which they'll try to avoid instead of something they want to adhere to. Faculty and staff, on the other hand, again generalizing, have generally a higher risk profile for COVID exposure, and many will want to limit interaction with the people who are spreading it. At the same time, many faculty cherish their autonomy in the classroom and elsewhere, which could lead to varied adherence to new rules about interactions on campus. I've heard a lot of concerns expressed about this from different institutions. So in the face of these various challenges, we think that each campus will need to develop and communicate what we expect of people very clearly, and we need to be deliberate in planning what to plan to enforce and how to do that. What rules are we going to set and how are we going to enforce them? In doing that, we're going to need to be flexible because the regional public health guidance will change and because new cultural norms take time for people to internalize. They need time to adjust. In the process of setting expectations, those I've talked with extensively about this believe centralizing COVID rules and guidance in one place for all groups of people on campus is the best approach to communicating and helping set new expectations. It helps emphasize as well that this is a community effort and it will simplify where people should look for any changes, as opposed to having particular changes made in student handbooks or faculty handbooks or employee handbooks that people have to search for. We need to expect to be able to communicate how things will work repeatedly as well, as the only way to affect change in how people behave, both with respect to students and faculty in particular, is to let them know repeatedly what is expected and let them begin to believe in that kind of change. We also need to be very deliberate about what we tell people they, quote, should do versus what they must do. That's part of what we need to do in setting up our rules. So we need to plan and embrace the need to take action to address violations of the new rules. That's what we'll need to do for enforcement. We probably need to do that with a series of warnings before any actual discipline as a general rule. Again, these are ideas to keep in mind as we move ahead. This slide offers some examples of guidance and a couple of policies to reference regarding what you think about telling people they should do versus what they must do on your campus. The Illinois guidance reference here was issued just last week. I'll be referring to some snippets of language from it in subsequent slides. I think it's worth reviewing whether you're in Illinois or not because it offers at least some idea of what one comprehensive view of how higher education institutions should consider setting up expectations and requirements. And it does set some requirements for institutions in Illinois, which I'll try to highlight today. The next link there to CDC guidance, which was issued just 2 days ago and focuses on testing ideas. It expressly recognizes the wide spectrum of variance from campus to campus, but offers helpful concepts to consider about whether to test, approaches for people who test positive, and related issues. The last 2 links listed here are policy statements that I've found to be what I think of as kind of early examples, not the only ones for sure, but early examples of policies addressing return to campus both for employees and for students, all in one centralized place. I think both are helpful. One is from one of the largest universities in the country that has its own issues relating to its size. The other is from a smaller liberal arts school setting. Again, I hope you find both of these resources helpful. Now, the next series of slides address some specific issues. We start with setting expectations for people about testing, meaning testing to see if people have the virus. Pete Enkel will talk a bit more about some technical options for testing, what to do with the data, and things like that. This slide focuses on the question of whether to do any testing and what we're finding. So the IBHE guidance I referenced in the prior slide, it illustrates the absence really of any requirement for schools to test the entire population, which is echoed by the recent CDC guidance from a couple of days ago. Some schools, in our experience, are planning to test everyone when they arrive, but our sense is that that's a minority of schools, at least that we know of. Others are planning to test various subsets of students, such as those living in campus-owned housing, people on athletic teams, and then also planning to test those who develop symptoms or direct people to get tested if they develop symptoms. The example here listed in the sub-bullet is some language from an online policy for a school that has not yet taken a position on testing and whether it will do the testing. I think this language is at least a good way to advise people now that testing may become necessary or required in the future if you're in that boat. Next, with respect to contact tracing expectations, we think it is important to inform students, faculty, and staff that everyone will be expected to cooperate with efforts to do that after people test positive. This is largely going to be a function of coordinating efforts with a public health authority and their directives in your area, but each school should be ready to inform everyone that they'll need to help out. Actual approaches to preparing for contact tracing vary substantially, and again, Pete Enkel will talk a bit more about contact tracing later. But I thought it was worth noting at least one example I know of a school that has required students, at least students, to pre-populate information about their regular expected contacts, who they expect to be in contact with regularly, as part of, to register that with the university as part of returning to campus, which I thought was an interesting approach and something that's unique to this current environment.
And Pete, I'll jump in with an example that I've been asked about by schools. They've asked about taking attendance in classes as a means to assist with contact tracing. And as your resident Title IV lawyer, I just want to note that if you require your instructors to take attendance in classes, you may be shifting some of your Title IV federal student aid compliance responsibilities. We don't have an answer from the department on how contact tracing through taking attendance would impact those. But if you're going to do that, be sure that you're aware of the risks and you coordinate with the department to make sure you're not messing with your Title IV compliance.
Thanks, Annie. And I think contact tracing is going to be new for everybody. It's going to involve a variety of privacy issues and concerns and things that we're all going to have to figure out moving forward. And it'll be a real change in how people interact, particularly students, and how forthcoming they're going to be about communicating about who they've been with and the circumstances that they've been involved with. And that's one of the issues I don't know that we really have answers to how to deal with. It's just to make sure we start preparing and communicating expectations to people. So our next slide has to do with safety measures and expectations relating to symptom reporting and monitoring and requirements that people will need to abide by every day. So the Illinois guidance contains a couple of requirements here, actually. We quote them here. They're worth looking at. They require self-monitoring of symptoms and require individuals to stay at home and obtain medical evaluation if they're showing any symptoms. Note in that requirement, there's nothing about a requirement to report to the school or for a school to test. The second requirement we note in that Illinois guidance is a requirement to self-quarantine or isolation when an individual has symptoms, has been exposed to an individual who has tested positive, or has traveled in a high-risk area as defined by the CDC. Again, that's an individual requirement, not an institutional requirement, but it is guidance that institutions should plan to abide by and enforce, at least here in Illinois. Some schools, in our experience, are going further by requiring students and or staff to self-monitor for symptoms. And in particular for staff, we've seen examples of requirements for them to submit daily what they call attestations, really writings indicating that they don't have any symptoms and can come to work. There are also schools requiring reporting of symptoms when they are present. When doing so, any school that plans to do that, you need to have a plan for how to keep that information confidential, what will be done with it, who will see it, and how it will be used. But it's an area that I think we're all going to have to make plans about. Another expectation for our safety measures that we're all very well aware of is masks. Basically, every school I think we know of is planning to require that pretty much everybody wears masks most of the time, anytime they're going to be interacting with people on campus. Some schools require it in all locations on campus. I've seen that more in the policies I've looked at for urban-centered schools. Others require it in public spaces. Some or most even are recommending that masks be worn even in private living spaces, particularly for students where they interact with others. And I know Sean is going to talk more about housing issues. But masks are going to be a big change from a cultural perspective for everyone to wear. And you'll need to make sure that your expectations are clear. With respect to large gatherings, the Illinois guidance also provides that here in Illinois, you can't have any inside that exceed 50 people. That's really the only provision that it provides about any kind of requirement. Each school is going to need to carefully define what gatherings they're going to allow. I think this is especially important for student populations because it's important for them to know what limits are required, which are recommended, what the changes are from their prior experience where they had pretty much a lot of autonomy about when and how they got together with people and how many. Some schools in that vein are requiring that any planned gathering has to submit a formal written safety plan outlining basically how social distancing measures will be maintained and people will maintain safe distance from each other, which I think seems like a sensible approach. Talking further about safety measures and moving past expectations, I have a couple slides here on enforcement issues. So the first one really is about how to generally address the idea of planning to enforce new rules about how your culture will work on campus. I think it's helpful to clearly and plainly decide what is, quote, required and what is recommended. You need to communicate that very clearly and then plan to enforce any requirements. That's a way of reducing risk and also of not enforcing your own rules, but also making sure that people know what to expect. The list of questions here are designed to highlight the importance of planning details of how to enforce requirements, to plan in advance of receiving reports of violations of these new cultural norms, and to retain some discretion for how to react and when to impose discipline. I think this area is going to be one of the most challenging, and we're going to have to see how it evolves, but these are some principles to keep in mind. This slide attempts to list a few more detailed issues that I've seen most schools list as requirements they plan to enforce. First, masks, obviously you need clear rules about those. Second, having a thermometer on the person, so a student needs to, in particular, be able to have one with them when they're on campus, which in the past they may not have. I think it's important to require that or to communicate that to students. And then there are 4 other items listed here that follow the topics we discussed earlier that you really want to make sure people understand what the requirements are and you're ready to enforce them. So my last topic has to do with accommodations for faculty and staff, focusing really on those who are at higher risk of severe illness if they are exposed to the virus. We've received questions from several schools about these issues and really focusing on process and for addressing such accommodation requests, which really involve changes in the work arrangements for particular employees to avoid risk to exposure. Maybe it's working from home or working in a different location or in a different way so that they aren't at risk of exposure. This can be from an underlying medical condition that creates the risk, but also age. And age is really a new issue for everyone to consider in any kind of accommodation question. So folks who process accommodation requests usually consider them permanent, but here we're talking about more temporary accommodations while COVID risk exists. So I think it's important for those who process that, particularly at larger schools, to understand that that's okay and that's a difference, but that's going to apply now for a period of time at least. And some schools have found it helpful to think about separating the process for any age-related requests from those for medical condition-related requests because they just involve different criteria. There's no need to gather data about medical condition or how it impacts someone's work. So we've had schools express interest in allowing people as well with child care needs to have preference with respect to working from home or not coming to campus. And we understand that impulse, and it can be acceptable, but it's important to be mindful of the potential for family status discrimination and issues that could be raised by single or childless employees, especially if they're required to come to work and feel unsafe, while those who have kids and have child care needs are allowed to work from home. This issue varies state by state, but it's just one to keep track of. Last, we have a list, an example here of a policy addressing accommodations for high-risk population. It's just one I think is particularly clear and particularly refined, which I thought I'd refer everyone to as a resource. So the next issue we're going to address has to do with managing residential housing issues, and I'll turn it over to Sean to address that issue.
Thanks, Pete. So I'm going to address three primary issues today. As Pete said, first we're going to talk about residential housing, including shared bathrooms and quarantine and isolation. Then we're going to talk about assumption of risk and waivers of liability generally. We've gotten a lot of questions about those with some specific examples in the context of housing, but the concepts are meant to be an illustration, so as you face similar questions across campus, you can apply them. Then I'm going to conclude my segment of the presentation by talking about some specific considerations faced by the business office to try to tie up a few of the loose ends throughout the presentation. And also just I'll add that throughout the presentation I'm going to be trying to share ideas that we've been hearing with lots of from other schools as we've been working with them on some practical considerations. So let's start with the residential housing. We know that you're working diligently to reopen your campuses and more importantly, develop plans and protocols to help keep your campus open all semester. To that end, we've been working with schools on their plans and we're trying to emphasize flexibility so that plans can be updated and modified as conditions improve or worsen and the criteria change. And from a legal practice pointer, when working on these policies and plans, we recommend including publication dates on them, but also including language about the plans not creating a contract with any employee or student and really reserving the right to interpret and change the plans at the school's discretion as you move forward. As Annie and Pete have said, state and local guidance is changing weekly and in some places daily, and we anticipate that that's probably going to continue through the summer and the fall. So really flexibility is key. With that said, and as Pete alluded to as well, my recommendation is to start posting your plans as soon as reasonably possible, particularly around these housing issues, so that your students know what to expect when they arrive on campus. We're going to be talking about assumption of the risk and waiver of liability in a few minutes, and informed consent is an important part of those legal concepts. But the new normal, as Pete described very well, is really going to require behavioral and cultural changes across our campus. And I think posting plans will help, our students with that process. Just to give a quick story, I was at my primary care physician to just get a general physical about 6 weeks ago, and he told me about a really cool interaction that he had with Dr. Fauci about 15 or 20 years ago. And he said even in the medical community, he was a rock star at that stage in his career as well. And when Dr. Fauci came to talk and present to the medical school students, they had a reception forum. Faculty and many of the students joined. We're going to have a happy hour social gathering and meet him and have a drink with each other. And then Dr. Fauci called him into the auditorium to start his presentation. And after everyone got seated, the first thing that he did was drop the lights down to black and turned on a black light. And everybody saw that their hands had glowing powder on it. Some had it on their face, some had it on their clothes. And unbeknownst to them, Dr. Fauci had put a little bit of this material on his hands prior to the start of the social hour, and then just saw how it transmitted throughout this social interaction. And so this story to me was just really put into crystal clear focus the behavioral changes that we're going to have to see on campus. And I think posting your plans and these types of communications is really going to help set those expectations on campus for everyone. And also everyone recognize that this is a joint effort and that everybody needs to participate. In my opinion, flexibility around academic delivery is going to be an important strategy for limiting transmission, both in residence halls and just on your campus. The more we can do to encourage those who are sick or don't feel well to encourage them not to interact with others, the less likely those folks are to transmit the virus to others. One approach that schools I've heard are doing, which is great, is to live stream all lectures. And that's a great idea if it works for your school, but we understand that all schools aren't going to be able to do that. Some of the other examples we've heard schools talk about is just recording audios or video versions of the course content and posting them on Blackboard or other LPM resources that students can access at a later date. Similarly, some schools are just coordinating and designating a couple of different note takers in classes where these materials will be posted, or making sure that instructors are posting the materials themselves. Also increasing virtual office hours to give students the opportunity to interact with their professors and instructors without having to do it face-to-face. You know, when I was in school, some of my classes were attendance was a component of the grade. Another good area to think about, do we really want to encourage that this semester? I understand why it's important and may continue to be down the road, but just something to help encourage those who don't feel well to avoid others. Another important strategy to decrease transmission, at least at the start of the semester, is to examine your move-in and orientation procedures to promote social distancing as much as possible. Many schools are looking at staggering move-in days and times. I understand that's kind of an administrative burden and hassle, but I think that's a really good idea. I really like that idea. Similarly, look at how you can limit the number of visitors that are coming on campus with your students. This is a big day for students and parents, and we get that, and it has to be a balancing approach to risk, as Pete was talking about. But we can do things to help limit and minimize risk there. Similarly, look at our orientation process in general and look for ways to consolidate, to do some of it virtually or consolidate it on areas of campus so we don't have students plus visitors moving around the various areas of campus to go to dining and then go to student services or library. If we can consolidate it, that will help some of the movement with the visitors on your campus. Once students are on your campus, housing configuration and assignments are going to be critical. We understand that configurations will vary greatly from campus to campus and housing unit to housing unit. The CDC is publishing or kind of explaining this as risk levels regarding residential housing. They've got a low, medium, high risk, is I think how they classify it. Low being, no one moves in. High being business as usual, and medium being some reduced occupancy on your campus. And most schools are taking the medium approach, which is why you're on the call now, or at least partly so. But what that reduction will look like is really going to vary on each campus. One of the things we're seeing is that some places are publishing that best practice says single bedroom, single bathroom. I get it. In a perfect world, you'd be able to maintain 100% capacity on your campus through the single bedroom, single bathroom model. but I understand that most institutions are just not set up that way. So how you set up your living arrangements is just going to depend on your specific circumstances. I do want to point back, though, to kind of your public state housing or your public state health agencies, and that whatever their arrangements are, we really need to make sure we're following any guidance that they publish or guidance that they may be publishing on these issues. To that end, we've been encouraging schools, and some schools have been trying to interface with their either local in city or the state health agencies to see if additional guidance will be coming out later this summer or prior to the start of the semester that may impact them. One of the areas that we're seeing is just general communal living orders that could impact your institution, or just general orders that could impact your institution, and working with those folks, the agencies, how that will impact your campus to maybe get excluded from that or better understanding of what is going to be expected of you. Schools are also considering creative ways to secure additional living spaces, both to increase distancing and capacity. I've talked with some schools that have worked with local hotels, and they've been able to secure hotels or large apartment buildings to create additional space. We're going to talk about quarantine in a minute, but some of the schools are actually trying to create this additional space not only to social distance now, but to create the quarantine space in the future, because it's been harder to secure that hotel, and we'll talk about it in just a second, to secure a hotel for quarantine purposes, and this way they can maybe leave a floor or a residential unit on their house, on their campus for quarantine or isolation. Most schools that I'm working with plan to do a deep clean of the housing units prior to students moving in, but then they're going to expect the students to actually maintain the cleanliness of the units after that initial move-in. I think that's very common, and I know you're going to get tired of hearing me say that, but these are the types of things that I recommend we communicate to students early and update as often as necessary so they understand what is going to be expected of them when they arrive on our campus. One example I know that some schools are doing as far as the bathroom situation in housing units, particularly where shared or they have a shared kitchen space, is they've been able to secure some bulk disinfectants, and they're placing those disinfectants in the units prior to move-in to help encourage students to utilize them throughout the semester. Seems like a low-cost way. If this is something that is available, you could do, not required, but these are kind of those practical considerations we're trying to provide examples of. Schools that are trying to adhere to the single bedroom model are facing another issue, which is they're getting requests from students and or parents that are requesting roommates, saying, well, I want a roommate. That's part of the college experience. In these circumstances, as long as someone isn't precluded by public ordinances, I don't think it's wrong to allow this, but we just need to advise of the risk of the students living together, the increased risk in transmission, as well as the possibility that they may need to end up quarantining or isolating together if, depending on what a state health agency says. Again, we just need to be communicating what the expectations are in advance. Another important strategy to limit transmission is to dedicate resources to high traffic, high touch areas. The CDC has provided guidance around these cleaning protocols, and I won't go into all the details on the recommendations, but I wanted everyone to have easy access to the link. We also know that schools don't have unlimited resources to hire additional staff to handle all these increased cleaning obligations or guidelines. So one of the recommendations that we're providing and hearing other schools is to work with your facility managers and your cleaning staff and figure out how we can restaff, reassign duties, and retrain to really prioritize these areas on your campus without having to hire additional help. I've also posted a link to CDC signage resources for convenience. Again, education here is key, and this is a pretty simple way. Posting signs in hallways and bathrooms to help educate and remind our students will be very helpful. Pete is going to talk in a little more detail about the health considerations on our campus, but I would be remiss if I didn't remind folks that really we need to be training our RAs on how to spot symptoms and what we want them to do when symptoms are recognized. Again, Pete's going to talk in a little more detail about those types of considerations, but we need to be thinking about how we're going to train the staff who's going to be interacting with our students on a regular basis. Also, we need to look at ways to encourage social distancing in the common areas. I won't go through all the details or issues, but look at look at water fountains and very simple things and those other type of amenities that we can shut off, remove, changing furniture, providing directional flow in hallways and elevators. Just simple things that don't cost additional financial resources that can help encourage social distancing in our common spaces. Restricting visitors is something that other schools are working on as well. We need to figure out how we're going to deal with campus community members and letting folks from other residence halls come into a different residence hall to visit their classmates. Friends and family, are we just going to ban it altogether? Some schools are doing that. One particular item that I wanted to share was third-party delivery services and food services that are come onto campus and commonly will go into housing units or other buildings on campus, and that a strategy that I like is to still allow the delivery on campus, but to require acceptance of the food or groceries, whatever it be, outside of the building, so that you're keeping it outside of the building. Like we've already discussed, single bathroom living arrangements are ideal, but communal bathrooms are going to be unavoidable on some campuses. This is just another good example of telling students what to expect in their residential hall before they arrive. CDC has published guidance on communal bathrooms, and I've listed them here. And I'm not going to go through each of these recommendations, but what I want to point out here is that many schools are saying that we are complying with CDC guidance or making those statements in their policies and plans and in their publications. And here, if you're doing that, that requires cleaning twice a day with EPA disinfectants. And this is just one example of how specific some CDC guidance can be and other guidance can be. So from a legal perspective, if we say that you're going to do something, we need to do it. And if not, you may be opening yourself up to liability. So if we're saying we're following CDC guidelines, we need to be following all of those guidelines. This is a residential housing resource page that I wanted to be included in your materials. It provides two, I think, very helpful links. The first is the CDC's Communal Living Guide. The second is ACHA's guide for considerations for reopening institutions of higher education. Again, as Annie said, want to have some solid resources for you all to access after you listen to the webinar and start working in more detail on your plan. And then need to just kind of reiterate again, state and local guidance is going to be key here and really vary by jurisdiction and really need to be monitoring that to make sure our plans work with those guidance or are flexible enough to adapt to them as things change. I want to conclude the residential housing section by talking about quarantine and isolation. We've been working with lots of schools on this issue, and I wish I could tell you that I have the perfect solution for every campus, but bottom line is I don't. Really, we just need to be creative and practical and create workable plan for how we're going to address quarantine and isolation space when we need it. I recognize that part of the problem is that state and local health agencies are strongly encouraging that we have this space and set it aside, but we don't have the answers or not provided the answers with how to do so. So what we've done here is list the ACHA recommendations around quarantine, isolation, housing, and the exact language is included in the link that I just provided. But what we're trying to encourage schools to do and help the schools with is study the guidance and try to help create a plan that's going to comply with the guidance. With that said, the guidance expressly states that not every school is going to be in a position to do these things and that they know that you're not going to be able to hit every one. But I think as part of your planning, you're going to want to show that you considered these things and maybe figure out why you can't accomplish them where impracticable or impossible. With that said, once we have these areas created, we do think it's important to start thinking about how you're going to be deliberate with utilizing your space. You're going to have cases on campus. You're going to likely have to send someone to these spaces, and the ability to stay open is going to be how we utilize these spaces. So really thinking through strategically how we're going to start sending students to those places in conjunction with our state and local health authorities and how they're going to want us to utilize those spaces. Again, the more flexibility you have, the higher likelihood you're going to be able to maintain and stay open for the entirety of the semester. I do just want to point out there that the spaces, the quarantine isolation space, don't have to be on your campus or even next to your campus. So you could have some other opportunities to locate these spaces off campus, whether it be hotels, apartment buildings. I have heard talking with a recent client that they served as frontline responder quarantine and isolation housing for frontline responders and agreed to serve as this function for the institution. So it's not impossible. I understand it may be difficult, but these are hopefully the creative approaches that many of your institutions are looking at as you're trying to find quarantine and isolation spaces. So with that, I want to move into assumption of risk forms and waivers. We're getting a lot of questions on these. I don't want it to be a deep dive, a law review type analysis of assumption of risk forms and waivers. But from a very practical perspective, assumption of risk forms educate our participants of known and unknown risks that may be related to a specific activity. And then each jurisdiction is going to handle differently what assumption of the risk is. Some states consider assumption of risk as basically a bar to negligence claims. Other states look at assumption of risk as an affirmative defense, or maybe even from a legal theory that there is no duty because the student has assumed the risk of coming onto campus in a negligence type claim. In other jurisdictions, assumption of risk is really a comparative fault element. So before the case is presented to a jury, the jury is asked to compare fault based on assumption of the risk. Again, I don't want to dive in detail as to all of these different methods, only that it can be a useful resource for your institution to mitigate risk. A waiver is a little different, and commonly when folks call us, they say, we would like to use a waiver form. And a waiver is actually a contractual agreement with someone to release liability in the future, and it really has a lot of your common contractual elements to it. There has to be consideration involved. Again, it's going to vary by jurisdiction what has to be in a waiver or if your jurisdiction even allows a waiver, but it essentially says, I agree not to sue you if I'm injured in this specific act. The courts disfavor these types of documents as you would expect, but that doesn't mean that they're not enforceable or that they can't be utilized to help mitigate risk in different situations. So a couple of just advantages to using these types of documents is, number one, they can make injured parties less likely to bring a claim. Similarly, they can act as leverage if you're trying to settle a claim because it can decrease likelihood of successfulness. You may be able to win on a dispositive motion with a court, and even if you don't, we've seen that they can serve as very powerful evidence at trial. When you're talking about assumption of risk and folks trying to deny that they knew that something was a risky situation, from my experience, juries have a very hard time believing that someone didn't read something that they signed, and that it can provide, it will help as they're either apportioning liability or fault, or even whether you were even negligent in that circumstance. So I think those are just some practical pointers as to those types of documents. A couple of quick pointers on increasing the likelihood of enforceability of these documents, and then I'm going to show some generic language that you can utilize in some of your documents. But what we're really trying to do is educate people of the risk as well as what we're doing to mitigate those risks so that they understand what risks they're taking on and they're agreeing to do so. So it's important to describe how the risks relate to the subject of the disclosures, roommates, communal bathrooms, extracurriculars, and what those risks are associated with that particular activity. Explain what you're doing to lessen those risks here, the transmission of COVID, but that it's not impossible to still contract the disease, and that there's nothing you can do actually to guarantee them that they will not contract COVID. Then throughout the form, you have them acknowledge the voluntariness and their decision to actually participate in the activity. Here it would be moving into the residential facilities, despite some of the risks associated therewith. We do need to make sure that they have the appropriate legal terms of your jurisdiction. Again, that's why you work with counsel. I'm going to show you what those look like here in just a second, but I can't emphasize enough that these are legal documents and legal theories, and that you need to work with counsel in constructing these documents to increase the likelihood of enforceability. And then, common sense one, but it doesn't do any good if we haven't signed the documents if we don't retain copies of them and can find them in the event that an incident occurs. Here's some sample assumption of risk language. This was actually from that I worked with and utilized from an addendum and in a housing agreement. There was a lot more information in the housing agreement about expressly how rooms were assigned, how bathrooms were going to be assigned, what responsibilities were associated with the student. But this is that type of acknowledgement that I'm talking about as to the risks associated with a particular activity, and that communicable diseases, including COVID, could be a consequence of the moving into the residential facility. But again, this varies by jurisdiction, as you can see the disclaimer I have at the bottom. Sample waiver sample waiver language. Again, this is built into another form, but a bigger form, but I pointed out here because it's a pretty aggressive statement that we're putting in our forms to have students sign. And bottom line is the optics of this, parents and students can be reluctant to sign it if we go all the way to the waiver and release language, something that schools are contemplating and making sure that they're willing to, number one, deal with, and two, the consequences of students or parents refusing to sign such documents and how you're going to do with them. So understanding how waivers work with assumption of risk and whether this waiver is even necessary in your jurisdiction is an important distinction as you're working through the decision of whether to utilize these documents. So with that, I want to spend just a couple of minutes doing some wrap-up business office considerations. And the first is we're talking about modifying schedules, modifying expectations on campus, modifying move-in dates. Yet we have contracts that run with enrollment agreements, housing agreements, dining agreements, really from the business perspective, making sure what our plan is going to line up with these documents. If they don't and they've already been executed, how we're going to coordinate that moving forward, and if we can just update them before they go out or return. Just practice pointer to think about. Pete Inco is going to talk about it in a little bit more detail, and Pete Land referenced it, but really we're dealing with a lot of new privacy issues here, from temperature checks, logs, to even more technological sophistication in screenings, questionnaires that we're generating massive amounts of what could be protected information, PI, and that we're maintaining it pursuant to our standards. We know we're creating it and we're safeguarding it. I also want to give point out that we did our colleague Tom Shorter and some others did a legal alert earlier this week on FEMA funding that's available to colleges and universities. Won't go into details here, only that it is available and it's something your institution may want to consider. If you want to look at that legal alert, it's available on our other resources. And then finally, just be mindful when comparing differences between virtual delivery to face-to-face delivery. We know there's class action lawsuits going on right now that those could be used as admissions as to why virtual options are less beneficial to face-to-face. And I know that's a delicate balance to strike, but I do think it's important to be mindful of those distinctions. So with that, I'm going to turn it to Pete Inco.
All righty, thank you, Sean. And folks, obviously we are getting close to the top of the hour, and I still have a bit of material to cover with you all. I will not at all be offended if you guys need to drop at 1 o'clock or whatever time zone you're in. The materials obviously are going to be posted. You'll be able to listen to the remainder of the recording, but if you bear with me, we'll get through this last bit of material here. So what I want to say with respect to this last bit of material is that there's not going to be a whole lot of law here. Rather, what I want to do is just kind of run you through very quickly some operational checklists that our team has put together that relate to a few key healthcare compliance and contracting topics that your health and wellness services or operations on campus are going to face as you begin reopening. And those hot topics are, in short order, telehealth, COVID testing, and then contact tracing. Let's dive into that telehealth issue first. From my vantage point, and admittedly it may not be the best, what's happening and what's going to continue to happen on college campuses isn't much different than what has happened and what is continuing to happen within the healthcare industry as a whole. Essentially what we're trying to do, and Annie had mentioned this and Pete Land had mentioned this, but essentially what we're trying to do is manage the pandemic, just as the healthcare system. And we're trying to do it in a way that avoids overwhelming the resources that we have and frankly allows us to keep our doors open. Essentially, we're trying to flatten our own curves, and to some extent, it's sort of kind of like, the ontogeny recapitulates phylogeny. Interestingly, just as many healthcare providers, last March and April, quickly shifted their operations to a virtual environment once the pandemic was declared and once the national health emergency was declared. Many colleges and universities should think about doing the same if they haven't done so already, and they should think about doing it either whole or in part. And what I mean by in whole is, it may be necessary at some point to simply eliminate face-to-face in-person encounters within your health and wellness services. If you don't want to go to that draconian an extent, what you may then do as an accommodation is simply implement appointment-only clinical visits. And obviously, while there's so many reasons that you would want to take either one of those particular tacks, the most important is, as everybody is keenly aware, keeping COVID-positive individuals apart from negative individuals is going to reduce the risk of transmitting the virus. Now, if your institution hasn't yet made plans to implement some form of virtual care, here are a few points to consider. First off, if you're already using a remote platform for your administrative and didactic activities, why don't you approach or think about approaching your vendor, your software vendor for those platforms, and ask them if they're willing to add telehealth software at little or no cost. We have encountered some clients who have had success in negotiating those types of outcomes with the software providers. Secondly, even if your health or wellness program is not a HIPAA-covered entity, consider licensing a HIPAA-compliant platform as a means of demonstrating that your institution is using best practices. Most health and well, maybe not most, but many health and wellness centers on campus are not considered HIPAA-covered entities, and we're not going to go into a HIPAA primer here, but they're not considered HIPAA-covered entities, and are questioning whether that is, in fact, the best approach to essentially default to a HIPAA-compliant platform. I cannot emphasize enough how important it is to take that approach, however, because really that's going to be the gold standard when it comes to delivering telehealth services. It's a way of demonstrating that your organization is employing best practices. And a list of those HIPAA-compliant software platforms can be found on that website that I've linked here. Now, I've got to forewarn you, however, that one of the hiccups associated with going with one of those HIPAA-compliant platforms typically involves a request on the part of the software vendor that your institution sign a HIPAA Business Associate Agreement. And they do that as a condition of basically offering that telehealth platform to you. Now, this has caused quite a few institutions pause when they're not a HIPAA-covered entity. But what I can assure you is you can probably, in most instances, go ahead and sign those BAAs without causing any concern to the institution, because generally speaking, the content of those HIPAA Business Associate Agreements is pretty banal, and it won't deviate at all from the requirements that are in the HIPAA regulations and the HIPAA statute. So you're just getting basically boilerplate language there. Now, notwithstanding that comment, notwithstanding that caveat, it's going to be worthwhile to run that business associate agreement, if you in fact have to field one of those, by your legal department for a quick review, and maybe to insert some disclaimers into the document that indicate that that particular business associate agreement is only going to take effect to the extent that the institution is considered a HIPAA-covered entity. So that's part one of our telehealth checklist. Part two is that we're going to shift gears a little bit and talk about situations in which maybe a portion of your student body is going to attend remotely and attend remotely while residing in another state. And if that is the case, certain strategic decisions are going to need to be made regarding whether to offer telehealth or, say, telebehavioral health services to those individuals. And after assessing a number of risk factors, including this item number 2, or the second bullet point on this slide, the availability of professional liability insurance, if your institution then, after assessing some of those factors, decides to go the route of offering telehealth care to the remote students in other states, rather than simply referring them to providers in their local communities, it's going to become necessary to determine the likelihood of their needing access to care. So, are we going to be providing services remotely in other states? And if so, what's the utilization rate for those services? If we find out that there will be a critical mass of students who are expected to require care in a particular state, then it's going to be necessary to advise or direct some of your practitioners within your health and wellness center to go ahead and obtain licensing or certification in that particular state. I want to caution you, however, that you shouldn't rush to license all practitioners in all states or all practitioners in all states in which your students reside. Generally speaking, the utilization rates, the patient volumes aren't going to dictate that that's an appropriate tack to take. You can probably get away with just having one practitioner licensed or two practitioners licensed in a variety of states in order to provide whole cloth coverage to your student population that is attending your classes remotely. Now, one other thing I should mention while we're on the topic of licensure is that I'm sure you're all aware that once the pandemic was declared, once the national health emergency was declared, a lot of states rushed to waiving licensure requirements for telehealth services. Those requirements that have been waived, or those waivers, will pretty much expire, at least currently, at the end of September. So, notwithstanding that those waivers were out there, it's still going to be necessary to pursue that professional licensure for those telehealth services. Now, we've got a couple other bullet points on this particular slide. I can run through them pretty quickly. We already referenced the fact that liability insurance is an issue. We don't want to be sending our practitioners out there bare when it comes to providing telehealth care. And there are two issues that needed to be looked at within your, or two aspects of your policy that need to be looked at. One is the coverage for telehealth, and then the other is the coverage for telehealth in other states. So ask your broker to check into that for you to make sure that you have adequate coverage in those instances. And then the next two bullet points really kind of harken back to something that Sean has said previously, and that is privacy is a huge issue as we try to manage the pandemic. And it's a particular issue with respect to telehealth services. And that will necessitate revising our informed consent processes to deliver virtual care, and in those informed consent policies really call out the privacy and security issues associated with that particular healthcare delivery platform. And then lastly, to the extent that you are billing for services rendered in your health and wellness programs, you're going to need to look at what your payers are saying in terms of whether they're going to pay for those services. And those are going to vary on a plan-by-plan basis. All right, second to last topic, COVID testing. It's pretty safe to say that all the colleges and universities out there are going to be implementing some form of COVID-19 testing for their students, faculty, and staff. And there's essentially three ways to go at this. We can refer students or faculty to providers within the community to go get tested. Alternatively, we can partner with a laboratory to perform testing on samples that have been collected within our health and wellness center, or we can go with a DIY solution, and that is to stand up a lab on campus to do that testing for us. Now, taking that first option first, here are some of the considerations, largely negative issues or factors that would cut against implementing this first option. Using a resource on campus will likely dissuade some persons from making the trip to get tested, even when it is indicated clinically. Similarly, inconvenient hours of operation can interfere with the need to get immediate or near immediate test results, and then implement any required isolation or contact tracing that needs to be initiated in response. And, notwithstanding all the federal legislation that's out there to the contrary, healthcare providers that are not under control of the institution, so healthcare providers that you're referring patients to, may, frankly, bill for their services, and that can cause some surprise and some dissatisfaction to members of your campus community. So be aware of that potential pitfall there. A couple other points to call out. One, as you're aware, depending on the type of test that's being performed, whether it's a molecular, an antigen, or an antibody test, you're going to get different results, and those results are going to come in different time frames. So if you do go the route of partnering with a community provider and making referrals to them, make sure you understand the type of testing that's being done and the type of results that you're going to get back. The last point I want to call out here is the ability of the provider to share test results with the institution. What you may find in simply referring members of the campus community over to a community provider is that once the testing is ordered and once the test results are received, that particular provider may not be all that inclined to share test results with you due to HIPAA concerns. So before making referrals, before entering into a referral relationship with one of those community providers, make sure you've worked out that particular HIPAA-related issue. So that was the first option. Option number two when it comes to COVID testing is partnering not necessarily with a provider like a physician group or a health system, but partnering with a laboratory to perform the testing. There are, just as there were with option number one, a host of issues that need to be worked through. Those kickers include, with respect to the campus health and wellness center, do we have the requisite number of trained staff to collect specimens? With respect to the laboratory, is the laboratory certified? Can it process the type of tests that we need? Can it handle anticipated volumes? That's a huge issue. And frankly, another huge issue is it going to charge for services? And just as with the community providers that we might be referring patients to, what's the mechanism for returning those test results to us? It should be less of an issue here because we are, in this model, considered the ordering provider, the ordering practitioner, and then the laboratory should be turning those results back over to us. But nonetheless, we need to address that issue at the outset. Now, if you opt for this door number 2 here, it's going to be likely necessary to enter into some form of letter agreement or memorandum of understanding that spells out who's doing what and allocates risk and liability issues associated with the delivery of that particular service. The last model is probably the most complicated model, and that is standing up a laboratory on your campus. Now, some of our clients have opted to go this particular route, but the 2 greatest downsides to this approach are, 1, the time associated with getting an FDA-approved test in place, and then 2, identifying resources to cover the front-end expenses, and then, frankly, once you're providing the testing services, continuing to get some sort of reimbursement or some sort of funding necessary to continue to offer that service. So, before moving on to this last topic of contact tracing, though, I got to point out that with respect to this last testing model, and frankly, with respect to the 2 prior testing models as well, it's critical that you have clinical protocols in place within your health and wellness programs which dictate the set of circumstances under which the COVID test is going to be ordered. We can't just kind of willy-nilly order tests on everybody. We're going to burn out our resources if we do so. So definitely between your physicians or between your nurse practitioners who are working collaboratively with the physicians in your health and wellness centers, it is necessary to come up with those clinical decision-making protocols. All right. Appreciate everybody hanging on. For those of you who have hung on, here's the last topic, contact tracing. Pete's already touched on this a little bit. This is an issue, obviously, for all our campus communities, and it's going to be particularly critical to our college and university athletic departments and the conferences in which they participate. As those athletic departments and as those conferences are trying to implement safe and effective ways of getting athletes back to intercollegiate competition. So given those circumstances, contact tracing, say that 5 times fast, is and will continue to be an essential public health activity. It can't, as Annie said at the outset, however, be undertaken in a vacuum. Rather, it has to be conducted, as we've said time and time again, in accordance with state and local health department directives and in conjunction with local and state health department officials. Where gaps arise, and this is an area where we can really add value as an institution, where gaps arise in staffing by state and local health departments, the university or the college can step in and augment information collection to ensure that those state and local health departments are making sound decisions in terms of providing advice and directives on isolation and on quarantine. And particularly as it relates to athletes who may have visited other campuses or athletes who may have visited other campuses in other states. And to that end, it's recommended that somebody within the university community undertake some sort of contact tracing training, and I've got a link there to that Johns Hopkins University site. That is free, so there's no cost to the university to do so. And then once that training is undertaken, put protocols in place, and then, as always, coordinate with state and local public officials. Okay, last slide. As you're aware, mitigation strategies in terms of responding to the pandemic are going to differ between on-campus and off-campus populations due to the ability to control the environments in which those students move. One tech solution that we've dealt with a few times is to basically set up mobile applications which can be pushed out to students' phones, to students' tablets. Whether that particular approach makes sense depends on a variety of factors, including cost, reliability, privacy, and security, and Sean had already flagged that issue for you. Those last two considerations, again, which Sean has flagged previously, privacy and security, are of particular concern here, given that what is being collected through those apps involves geolocation, social and health histories, and those are inherently private and sensitive bits of information. So if we do go down this path of implementing a mobile app to do some contact tracing, I think the questions that need to be asked are really fourfold. Who's going to be the custodian of the data? Where will the data be stored? How will it be secured? And for what purposes might it be accessed or used beyond the contact tracing? And with that, I've blown over the time tremendously. I'm going to kick it back to Annie. Annie, take it away.
Thank you, Pete. And thanks to everyone for joining us on our program today. We received a number of questions. We've woven the answers to many of them into our presentation, and we'll follow up as we're able. Also, thanks to the Petes and Sean for providing so much content today. And I'd be remiss if I didn't give a big shout out to Husch's events team, which has helped us deliver so much content at a breakneck pace in recent months. We hope the information we provided was helpful to you and your institution. If you haven't already, please click on the survey icon at the bottom of your screen to complete our short survey. Your feedback really does help us in providing future programs. We welcome constructive criticism on any of our complementary programs, and in particular, thoughts on specific additional issues you would like to see addressed in this or in other formats. As a reminder, this program's been approved for Illinois, Iowa, Nebraska, and Tennessee continuing legal education credit, with Wisconsin and Missouri credit pending. A recording of the webcast will be available tomorrow, and a link will be sent to you that will be valid for 2 weeks. This concludes our webinar. Thank you.